Welcome back. In this video I'll talk about atrial flutter and I'll teach you everything that you need to know from the ECG to the symptoms, the causes and the treatment. Atrial flutter results when the atria contracts very rapidly at a rate of 250 or 350 beats per minute. That's 5 contractions every second. This of course can be deadly and it can increase the risk of having clots inside the heart. These clots can be formed inside the atria and they can travel to the lungs to cause pulmonary embolism. In the ECG you will see a very characteristic saw-toothed ECG, which are P waves that are successive and they all look the same and they are very sharp, much like the teeth of a saw. Exam makers love to show this ECG and ask about the diagnosis. The main cause is recurrence of electricity inside the atria. Normally, the electricity travels from the atria to the ventricles, and this causes the contraction of the atria and then the ventricles. But if you have some electrical waves going around in the atria, it will cause recurrent contractions as it travels around the atria. The patient will have some vague chest symptoms with tightness in the chest, shortness of breath, and sometimes fainting. Palpitation is also a very common symptom. For these patients, we need to treat two very important conditions. One, of course, is the atria itself, and we use this by using an ablation method where we cauterize the affected area and prevent the electricity from going around and around. And secondly, we need to give these patients some blood thinners to prevent the formation of clots, which, like we said, is an increased risk in these patients. Our ECG course contains all the changes that can occur in an ECG, and it helps you become an ECG expert, so that you can recognize any ECG that you might come across. The course contains everything that might affect an ECG, all the symptoms, the causes, and of course the treatments. It also has plenty of quizzes to test your knowledge and make sure that you cement these informations and be able to answer any question about an ECG. You can access the course using the link in the description or in the pinned comment.